Imagine feeling a slow, burning ache right in the center of your stomach. An ache that keeps returning day after day. Some meals make it worse. Stress makes it sharper. And over time, you start to wonder, is something wrong inside my stomach? Today, we're uncovering the real story behind stomach ulcers. What they are, why they form, the warning signs you should never ignore, and how they're treated so you can heal with confidence. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes, and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. A stomach ulcer, also called a gastric ulcer, is essentially a small wound, a break in the protective lining of your stomach. Think of your stomach lining as a shield. It faces strong stomach acids every single day. When that shield weakens, acid begins to irritate the tissue beneath, creating a sore, an ulcer. Now let's talk about how this feels. Most people describe a burning or gnawing pain in the upper belly, right in the center or slightly to the left. Sometimes it starts soon after eating, sometimes hours later. You may notice bloating that makes your abdomen feel tight and swollen. Retching, that sensation of almost vomiting, but not quite. Nausea, occasional vomiting, or a strange, uncomfortable fullness after even a small meal. And because the stomach acid escapes into places it shouldn't, many people also experience heartburn, that familiar burning sensation rising up into the chest. But why does an ulcer form in the first place? Here's where the story becomes clearer. In almost 80% of cases, the culprit is a tiny spiral-shaped bacteria called Helicobacter pylori, or H. pylori. This germ hides in the stomach lining, causing irritation and inflammation. Over time, that irritation erodes the protective layer and an ulcer forms. Next come certain medications, especially non-steroidal anti-inflammatory drugs, or NSAIDs. Ibuprofen, naproxen, and aspirin are incredibly common. But when used in high doses or for long periods, they can quietly damage the stomach lining, opening the door to ulcers. There are other, less common causes too. Smoking weakens the stomach's natural defenses. Rare viral infections can play a role. Conditions like Crohn's disease or Zollinger-Ellison syndrome can increase acid production. And very rarely, stomach cancer may initially resemble an ulcer, which is why doctors often take a biopsy to be absolutely sure. If you're wondering how common this condition really is, the answer might surprise you. Stomach ulcers affect somewhere between 1 in 10 and 1 in 20 people during their lifetime. They used to be far more common before modern treatments, especially H. pylori therapy, became widely available. But while more rare today, ulcers can still lead to serious complications. One of the most dangerous is bleeding. Fast bleeding may cause vomiting of bright or dark blood, something doctors call hematemesis. Slower bleeding may turn vomit into a dark brown, coffee ground-like appearance. And when blood passes through the intestines, it can make stools look black and sticky, a condition called melena. All of these are medical emergencies. Another complication is perforation. This happens when the ulcer drills a complete hole through the stomach wall, allowing acid and food to spill into the abdominal cavity. The pain is sudden, severe, and unmistakable, and it requires immediate hospital care. Very rarely, ulcers near the outlet of the stomach can cause obstruction, leading to severe vomiting and difficulty keeping down food. So how do doctors diagnose a stomach ulcer? They start by looking for H. pylori, either through a stool test or by taking a sample during a procedure. Blood tests can look for anemia or check the health of the liver, kidneys, and pancreas. But the gold standard test is a gastroscopy. A thin, flexible camera is gently guided down the throat so the doctor can see the stomach directly. If an ulcer is found, a biopsy is usually taken, not because cancer is expected, but to confirm that everything is safe and treatable. Once diagnosed, treatment begins with calming the acid. Medications like proton pump inhibitors or H2 blockers reduce acid production dramatically, allowing the ulcer to heal. These medicines are usually needed for 6 to 8 weeks and work extremely well. If H. pylori is present, antibiotics are added to eliminate the infection. Clearing the infection is crucial. Otherwise, the ulcer often returns the moment treatment stops. If NSAIDs cause the ulcer, stopping them is key. But in cases where these medications are medically necessary, like aspirin for heart protection, doctors often prescribe long-term acid suppression alongside them. Surgery today is rare. It's reserved for emergencies like heavy bleeding or perforation. And of course, lifestyle choices matter too. Eating smaller meals, avoiding personal trigger foods, reducing alcohol, stopping smoking, and not lying down soon after eating all support healing. Once treatment is complete, doctors usually advise a repeat gastroscopy after 6 to 8 weeks. This ensures the ulcer has fully healed and confirms that no other condition was hiding beneath. So what's the takeaway? A stomach ulcer is not a life sentence. With the right diagnosis and treatment, most ulcers heal completely. What matters most is listening to your body, recognizing symptoms early, and seeking help when something feels off. Your stomach is resilient. It can heal, and so can you. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.